Have you ever wondered why someone who has spent years training in a highly reputable profession has chosen to walk away? I'm Tina Madsen. I'm a certified hypnosis professional, and I'm here with Chiasson. She is a worldwide leader in the hypnosis industry. She also has her own training practice where she teaches and trains others. Penny, let's get into this a little bit. I want you to tell me you were a CRNA, a nurse anesthetist. You spent years at the head of the operating table, managing pain at the absolute highest level. And somewhere in the middle of that, you went down a rabbit hole and you started hypnosis. Tell me a little bit about that because you were trying to solve a clinical problem. What was the problem that actually prompted you to leave a well-established career that you spent years training for?
It didn't prompt me to leave the career, but it started the path that ultimately led to that. And what happened was there was a clinical situation in the hospital where I worked. And when I heard the details of what happened, I thought to myself, there's so much I learned about pain management as a nurse anesthetist that I did not know when I was an ICU nurse. And it's really simple to understand. It's just a matter of somebody putting the information together and teaching someone. I began to review the literature. And as I went down the rabbit hole of the literature, I realized, okay, if I'm going to address this, I have to present the solution to the problem of what do you do when the pain medications have sedated the patient too much, but they're still in pain? What are the options? And that was where I uncovered the massive, and I do mean massive, body of research on hypnosis for pain. And I'm not talking a cut or a scratch, I'm talking surgeries, hypnotic epidurals for labor and delivery, even going back to the 1800s where entire surgeries were performed with hypnosis.
Okay, so from there, you did the research and then you began writing a seminar to help registered nurses manage pain in patients. These are the
Yeah.
ones who were too sedated for narcotics. And you kept finding this body of research and you just couldn't let it go. So, what were you finding? Why couldn't you let it go?
It just kept nagging me in my mind. And the reason why I couldn't let it go was not just the seminars, but at the hospital where I was giving anesthesia at that time had something called the Center for Healthcare Integration. And patients could come into pre-op early and get healing touch or Reiki, or they would follow a protocol that's based on a book by Peggy Huddleston called Prepare for Surgery, Heal Faster. So these patients would come into the operating room with a piece of paper pinned to their hospital gown, and it would say, "Dear anesthesia provider, please read these 3 statements 5 times as I'm going under anesthesia, and then read them again as I'm coming out of anesthesia." Those patients took less medication during the surgery, and they required less pain medication to wake up just as comfortable as other patients at the end of the surgery. And when I say less medication, it's not about withholding. You look at a patient's entire scenario when you're in anesthesia. You're looking at vital signs, you're looking at their rate of breathing, because the one thing we look for when it comes to taking care of someone with pain is the only sign that we have under anesthesia is that nervous system response. Are they in fight or flight during the surgery?
Okay, so then fast forward to 2013. You found a hypnosis training taught by another CRNA, someone who'd been practicing hypnosis for decades.
Yeah.
There was something that you mentioned, and it was something about day 5. Walk me through day 5 of that training.
Yeah. So I went to this training because I wanted to understand the science between hypnosis and pain management. That's just something I was passionate about at the time. I had seen many other trainings and they didn't get beyond my first glance until I learned about Ron's. And on day 5, Was
Ron who? Sorry to interrupt.
Ron Esslinger. He was
Okay.
considered the king of pain
Okay.
when he was living and practicing. So day 5 was the day where we learned about glove analgesia. And glove analgesia is also considered dental hypnosis. That's another term for it, where you can guide someone deep enough into hypnosis that you can give them suggestions that their brain will block pain. So it was very interesting to hear about that, to learn about that, and to understand how it actually happens.
So there was a point in time you were telling me about something where he voluntold you to come to the front. Tell
Yeah,
me a little bit about that. He voluntold you, guided you, and I'm going to have you tell it because I have snippets of it. I've heard when you trained me years ago now, but
yeah.
guided you deep into hypnosis. And then what happened next?
So this was a life-changing moment for me. This is the moment that it went from being a curiosity and being a seeker of knowledge to holy wow. So when he called me to the front, I already knew what he was going to do. I had seen the videos on his website, and my mind was already going into overdrive. And I said, no, you know what he's going to do, and you know he knows what he's doing, and he's damn good at what he does. Just shut off the chatter and follow the instructions. And you've heard me say that many times in training. It's just shut off the chatter and follow the instructions, and you're going to be fine. So he had me take a seat on the bar stool, and he guided me deep into hypnosis. He used the old Dave Ellman induction. It's been around since the 50s. Everybody loves it. And then he gave me suggestions like your hand is, it's almost as if you put your hand into a bucket of liquid rubber and you take your hand out and your hand's all rubbery. Or it might even be as if you put your hand into an ice chest to pull out a soda and your hand got so cold it's completely numb. He's just layering on suggestions like that. And then the next thing I know, I heard the surgical clamp snap shut. Now, as an anesthesia provider, that was significant to me because the clamp he clamped on the back of my hand was the same surgical clamp that an obstetrician will use to check to make sure the skin is numb from a spinal or an epidural before they begin a C-section. I heard when he snapped it shut on the back of my hand.
So to someone who's listening, like how intense is that? It's like how tight does it clamp down?
He clamped it 2 snaps. He clamped it tight enough that the impressions from the teeth, yes, there are teeth on the edge of the clamp, were on the back of my hand for 2.5 hours.
And as he did that, and what did you feel?
I reacted facially, and he said, "What do you feel?" And I'm like, "I know you're touching me, but I feel absolutely nothing." My mind was blown. I made that wincing face because when my brain heard that snap, my
You knew what it
brain
was.
thought that's what I was supposed to do, but I didn't actually feel anything. And I remember thinking, holy fuck, this is so powerful. How come nobody taught me? I'm working with patients dealing with pain every day. How come no one has ever taken even 30 minutes, an hour to talk to us as anesthesia providers about how we speak to patients when they're going in and coming out of anesthesia actually helps the brain reframe the entire experience. That's what was happening with the people that would have the piece of paper pinned to their shirt, their
Okay.
gown before they would go into hypnosis. So that was a moment that I just, mind was blown, and it was divine intervention. You know, I'm a spiritual person,
Yeah.
and that was just the universe's way of creating this moment where I couldn't deny what it is I was supposed to be opening my eyes to.
So it was no longer going down the rabbit hole. And from what I recall, you'd said I left, my mind was absolutely blown, and I drove home and told Ron what?
I drove back to the hotel, but when I got out of class, I called him and said, just so you know, when I come back to Connecticut, I'm opening a hypnosis practice. And he's like, well, wait, what? It blew his mind because that was not the plan at all. I was getting anesthesia credits for being there. So it was a continuing education
So continuing
experience.
education, but it left you with what type of understanding around pain, the mind, what hypnosis actually was like, where did it leave you with that?
So I'm gonna quote Ron Esslinger and say, there is no pain until it reaches the brain. And every major area that is involved in pain perception is influenced, available, active, and accessible in a hypnotic state. And all of those areas also connect to the areas of the brain that when we get into overthinking, fear, worry, anything that triggers fight or flight, those areas of the brain can be influenced by hypnotic suggestion in hypnosis. And part of me was actually irritated and disgusted that nobody was teaching these things in nursing school, nurse anesthesia, much less medical school.
Okay.
So I just was like, no wonder people say a patient's attitude is half the battle. What I learned in that anesthesia training and through my years of practice working with people with physical conditions as well as their own self-esteem and stuff is that your attitude is 99.9% of the battle.
Yeah. Okay. So you opened up your practice. This was in 2013. You ran it until 2015, and then you relocated. So you closed your practice down. But tell me, looking back, after you'd had that experience, that moment with the clamp, what was that like to then have to set it aside?
I didn't want to. I didn't want to. My
Okay.
husband wanted to move back to my I didn't want to move back to my childhood home. My husband wanted to move back to my childhood home, but the only thing that was anchoring me in Connecticut was that I knew there was a large enough population of people open-minded enough to use hypnosis. I
Okay.
had the automatic limiting belief that I wouldn't be able to restart a practice here in Mississippi right away.
You had that limiting belief.
Mm,
Okay. So then there was something that shifted for you, wasn't there? Where, I mean, you've
yeah,
talked about this openly on your podcast where you found yourself. Tell me what shifted for you.
yeah. So the first couple of years I was here in Mississippi, the only job I could get credentialed in was an anesthesia position where there was a lot of call. There was no set time you got off. We worked on what's called a number system. And so, based on what number you were when an OR room closed down, you got to go home. So, if it was a busy day, I could be the first person to go and it'd be 6 o'clock in the evening before I got out. And then my peers are still there working. So, there was really no way to have a practice where I could commit to people. The more I stayed in that, the more internal turmoil I was in because I knew I was not doing the thing that just lit me up and on fire because I had started to go part time when I was in Connecticut. I had started to go part time in anesthesia within a year because I was that successful in the hypnosis practice and I loved it so much. So there were some other things that happened prior to us moving. So you take that and you add the values misalignment of people now are very aware that healthcare is a hot mess. But having been in healthcare for 20 years, 25 years at that point, I could see it all around me. And I was operating in a system that I did not sign up for.
Well, and
So,
you were partially experiencing that yourself, that misalignment, right?
yeah,
Like,
that whole misalignment of values.
so tell me, what was that like for you? Like when you were in that phase in 2017, what shifted for you?
They call it moral injury, right? When you know you can do your best, but you're not given the means to do your best. So there was that. There were some emotions from some other things that were going on. And it hit a point where I couldn't keep the genie in the bottle anymore, really, is what happened. I was using work and busyness to not have to sit with how I was feeling. I was using working all the time on the farm or at the hospital to not feel, to numb
Well,
out.
we know what that cycle is now. It's my favorite thing. So, okay,
Yeah.
so what did you do to, shift things for yourself? What shifted?
Yeah. So one day, like I said, the genie came out of the bottle and you can't put it back in.
No.
And I was in a complete mental and emotional crisis. They call it the technical term for it is a brief reactive psychosis. And all that means is that you have an event that causes so much emotional distress, you have no capacity to handle it.
Okay.
And so it very quickly, I mean, within hours of the trigger, it led to me becoming suicidal. And so I had to reach out and get some immediate support. And if I hadn't been a healthcare provider, I don't think I would have recognized what a slippery slope that I was on. But I did the counseling, I did the medications, I did all the things. And every time I went to counseling, it was like ripping the scab off of a wound to let it bleed. And then every week you go back and it was the same thing. But we did get to the core of it. And it was anger that was underneath the surface. And it was anger at a lot of things. I was frustrated. I had to close my business. I was frustrated around things that had happened before we moved. I was angry because I was consuming politics and news, and I was angry because I couldn't do my job that I knew I was capable of doing in the healthcare system. And it all came out. It was just a big, ugly mess. And I finally looked at my counselor one day once we pinpointed that it was anger I was feeling. And because she was like, "Oh, it's anxiety." I'm like, "It's not anxiety." But now I have come to know through doing a lot of this work, anger can present as anxiety. And most people think anxiety is fear. It's not always fear.
Yeah.
And so I told her, I said, "I want to reach out to my mentor." And she said, "What do you mean?" I said, "I know that this is anger, and I know that you and I have a conversation is not going to get to the root of what's going on." And my mentor, he created the framework that I used with clients, and I know he knows how to get to it. And he was ABD, his PhD in psychotherapy. And I told her that so she would feel comfortable letting me work with a hypnotist being I was in such a vulnerable emotional state because I was barely hanging on. I was not coping well at all. And I'm saying this because there's a line between what's appropriate for someone who doesn't have a licensed clinical background. And I
Yeah.
knew I was over that line. I booked in virtual sessions with him and we did 4 sessions in 2 weeks. It was two Tuesday, Thursdays back to back. And after the second Tuesday when we did the forgiveness session, it was like somebody had taken a staticky TV and finely tuned it, or had taken a cluttered whiteboard and cleaned it till it was pristine and brand new. My life did a 180, and I spent several months begging them to wean me off the antidepressant medication they put me on because it's not one that you could abruptly stop. But they finally did, and I've been fine ever since. But that was a couple of different things, and maybe we
So,
can get into that on some other call, but that
yeah.
was the pivotal moment where I knew that if I was going to maintain my mental and emotional health, I had to get back on the path of what I'm here to do.
So it really sounds like that experience gave you something that no credential, no letters, no education could possibly give you. So I'm
Right.
curious, what was it? And how did it change the way and transform the way that you sit with clients now?
Ooh, that's a deep question. So the one thing that it gave me that no credentials could give me is to understand how quickly emotional pain can become so intense that ending your life seems like it would be much more appealing than continuing to endure the pain to work through it. And this happened in a matter of 2.5, 3 hours, that all of this emotion finally, when it hit that breaking point coming out, I was in so much emotional pain. And I did try calling people. People were busy, were at work, and it's not their fault. Nobody was expecting me to fall apart that day because I'd
Yeah.
held my shit together for so long. held it together. I masked it by doing so much.
Most
But,
do.
you know, it's a thing in healthcare where people will make cracks and jokes about people who attempt suicide, or they're
Wow.
making a gesture. Not people who do things like a attempt to, but people who will take 10 Tylenol or a bottle of aspirin or something like that, or claim they did when they did not. That's the other thing. No, people make jokes and then they say things like, "Oh, it's selfish, it's this, it's that." The emotional pain was just intense. So it gives me a totally different perspective around how it doesn't take a lot. When you're already carrying a load, it doesn't take a lot to flip you into that space. And I mean, I was fighting for my life mentally, and that's one of the things that pushed me to the point, like, I have to have help. I'm losing this battle, because I was fighting to live on the inside in spite of the intense pain. But the
So,
other thing that I realized is when I shut that practice down, I had just learned a very powerful, and that word gets overused a lot, but it's true. I had just learned a very powerful mind, body, spirit, self hypnosis technique. But when we packed up to move, I had not yet built that habit in my life, and I got busy and I forgot about it. And if I had just picked up that practice, I don't believe that day ever would have happened.
wow, hindsight, right? We don't know what we don't know. You did end up
Yeah.
eventually, finding a beautiful path to move through it. I personally, I'm eternally grateful because you shifted my life. But, from there, I was 2017. And if I recall correctly, you reopened your practice in 2018. And by late 2019, so not that much later, you had resigned from anesthesia entirely. And
Yeah.
people called you crazy for walking away.
They did. My mom asked me for a long time, so when are you going to go back to your job?
What were they missing? Like, what was the missing piece of that?
Some people normalize where you are and you go into a job and you stay there till you're vested for retirement, and then you can do something else after you retire. And there were a lot of different attitudes coming at that and a lot of different perspectives, and they're right for the people who held them, but they weren't right for me. And a lot of it came from, why would you walk away from a state job where you're going to be vested in another 6 years and then you can just retire? And the thing is, I had lived long enough and I had worked in enough different environments giving anesthesia that I knew that the grass was much greener in other places, but I could also see how much the healthcare environment was changing. And if I was going to stay mentally well and healthy, I couldn't stay there. And so people just didn't get that. They've never walked in those shoes, so they don't understand it. And they thought it was just nuts. And to be honest, I had planned maybe in a few months to come back and work a shift here and a shift there just to keep my credentials. But then COVID happened, and COVID happened when my CPR and my advanced life support, all those things expired when COVID was in its full throes. And because I wasn't a full time or part time employee somewhere, I was what's called locums. Nobody would let me through the door to renew my credentials. And that was, again, just divine intervention, because in 2021, I just let my CRNA board certification go. I just let it go. And I busted my ass working for that. And it was kind of scary to do it. But when I walked away, I still had student loans I was paying, but my mental and emotional health was far more valuable to me than a steady paycheck from a place that was just soul sucking and taking the life out of me.
So I want to back up because you mentioned something interesting. Because when I first met you, it was in 2019. And then in November of 2020, you were hospitalized with COVID and you were on 60, 60 liters of oxygen.
A minute. Yeah.
Wow. Okay.
Yep.
So your body had shut down and you tell me you use self-hypnosis
Yeah.
multiple times. So this very same practice, the one that you didn't stick with, you learned your
No,
lesson.
it was a different practice.
Oh,
It was a
okay.
it was a very different practice because we're dealing with something different here. So I love mind, body, spirit, self hypnosis. But when you're dealing with something that's a physical illness, physical symptoms,
Yeah.
I used a completely different approach that went all the way back to my pain management.
Obviously it worked because you're here, but what were you doing?
So, well, for the first 2 days, I wasn't doing much. The first 2 days, all I was doing was concentrating on not losing control of my breath. In anesthesia, ICU would call it guppy breathing, where you're taking these really quick little breaths. I could speak. When I went into the hospital, I could speak one syllable at a time.
Wow.
That's how I was breathing, almost like a very shallow panting. So for the first 2 days, I just stayed focused on my breathing because I would have coughing fits. I was at a hospital that didn't have an ICU. There were no ventilators, and they told me there are no ICU beds in the state. You have to stay here. So that immediately, I mean, I already knew how sick I was. We did our best to manage at home because there were so many limited beds. You had to be 1 foot 1 foot
So,
through the door to even get a bed. So 2 days later, when I was feeling somewhat better and I wasn't thinking about breathing, I thought, oh my God, I need to be doing self-hypnosis.
I mean, it obviously worked because in February of 2021, you were hiking in Sedona.
I was hiking in Sedona. So yeah, I was on that 60 liters of oxygen. I think this is the most important part because I'm all about identity. On day 3, a doctor who was not my doctor walked in. He's at the foot of the bed and he looked at me and he said, and he's known for having a gruff bedside manner. And that I don't care if somebody has a gruff bedside manner if they're a good doctor, right? And he looks at me and he said, ma'am, your chest x-ray is terrible. You are going to be a pulmonary cripple. And I said, no, sir, I will not. I will walk out of this hospital next week. So
So,
I made a declaration. Go ahead, ask your question.
well, what is that? I mean, what was your takeaway? What is that story? Him telling you where you were going to be, you saying, no, sir, I'm going to be walking out of here, and you making a declaration. What does that tell you about, you know, the mind body connection?
Yeah. Well, I mean, it was what I knew. And that's why I rejected. I know all about the placebo and the nocebo. If I had accepted what he said, it was guaranteed to happen. So
Oh,
I just
yeah.
rejected it. And then I started using the self hypnosis that day. I'm like, what am I doing? And so that first day, I spent 4 hours, 4 or 5 hours in hypnosis the first time. And it was just all about setting my intention and programming my mind for the desired outcome, not for what I wanted, but for the desired outcome. And that's what so many people get wrong when they pray, when they do hypnosis, the whole 9 yards. I was focused on the end result. And it made a huge difference because I was discharged home after only 12 days with oxygen just as needed. And like you said, by February, I was hiking in Sedona. Now, it wasn't like hiking up a mountain, it was a 1 mile hike at Mesa Vortex, but it's still, there's hill. You're
Yeah.
already at elevation. I did have to stop and rest a lot, but I did it.
All of that from a single surgery clamp. Wow.
Yeah.
Thank you for sharing.
You just have to pay attention. Life gives us clues. We pay attention to these little things and not just blow them off. You never know what's going to happen.
Hmm. Thank you for sharing, Penny. It's always a pleasure to hear about how things shifted and how things evolved. For those of you that are just listening in with Penny and I, if you have questions, please don't hesitate to reach out, follow along, subscribe, DM Penny or myself directly. If you want to hop on a call with either of us, please don't hesitate. We look forward to connecting with you.